Welcome to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Each 10-minute episode features conversations with our authors on translating their research findings into practical and policy recommendations that will ultimately improve patient, community, and population health outcomes.
Welcome to a new episode of JCIH podcast, Health Communication Distilled, a podcast series from the Journal of Communication in Healthcare, Strategy, Media, and Engagement in Global Health. My name is Marwa Ibrahim, and I'm current Communication, Technology, and Social Media intern for the journal. Today, we have with us our author, Dr. Jennifer Bute, and Dr. Maria Brann, who will be discussing the research Expectancy violation and boundary management when giving birth during the pandemic, implications for supporting women, which we published online on the 11th of October, 2023. Hello, Dr. Jennifer. Hello, Dr. Maria.
Hello.
Thank you very much for being with us today. Could you please start by introducing yourself and summarizing your study in few words?
Yeah, I'm Dr. Jennifer Bute. I'm a professor of communication at IU Indianapolis. And in this study, we were interested in women's experiences with giving birth during the first wave of the pandemic. We focused on women who were located in the United States. And in this analysis, we looked at some of their expectations for how the birth and returning home with their infant would go, and also how they managed access to themselves and their newborn, both in the hospital and once they were home from the hospital.
Okay, interesting. Dr. Maria, can you please introduce yourself?
Yes, my name is Dr. Maria Brann, and I am also a professor in the Department of Communication Studies at IU Indianapolis.
Thank you. Dr. Jennifer, what motivates you to conduct this research?
Well, we have always been interested in communication about women's health. There's actually a fairly large literature that exists on women's birth stories. But once the pandemic really hit in the United States, we became interested in how restrictions related to prenatal care and childbirth would affect women's birth stories during that unique context. And so we decided to build on that literature by examining birth stories of women who gave birth during the first wave of the pandemic.
Great. My next question for Dr. Maria. You have mentioned in your research two theories, expectancy violation theory, and the other one is communication privacy management. Could you please elaborate more how these theories relate to your findings?
Expectancy violation theory really focuses on our reactions, both the positive and the negative, when our expectations are violated. So, for instance, women often expect that they're going to have a positive birth experience if they've heard positive narratives about it, or they might think that there might be something negative if there's negative stories that they've heard about it. And when something contradicts that, then it can violate that expectation. We often focus on negative things because we often hear about the negative things. And so like being dissatisfied with the birth experience because of the stress, or maybe being dissatisfied because of restrictions when we were with the pandemic. And we did see some of that with our findings, but our findings also recognize that there were some positive expectancy violations as well. So we really want to try to focus on not just the negative, but also the positive. If we focus on the positives and communicate in ways that can foster more positive experiences for women, then they're likely to have better outcomes. And so that's really one thing that we want to highlight. And then in terms of the communication privacy management theory, This is a theory developed by Sandra Petronio in the field of communication studies, and it uses this boundary metaphor to describe how people manage their privacy. And traditionally, the theory has really looked at the management of private information, but we know that the theory actually has room to look beyond just the words and the verbal communication, but can also look at some of the nonverbal as well. And so in this theory, we were applying it specifically to some nonverbal communication, looking at space and territoriality. When we use this theory, we were looking at how they managed the information, but also how they chose to manage their space, particularly around their newborn, but also then how the organization or healthcare system imposed some of those rules and restrictions on the space as well.
Blessing in disguise, they found that. Yeah. And silver lining, which is very interesting. Yeah. Thank you. My other question for Dr. Jennifer, from your research, in your opinion, to what extent policies and rules affect interpersonal dynamics and people's lifetime events, such as childbirth, or how our lives are shaped by rules and policy, do you think?
Well, we really found, based on our data, that rules and institutional policies had a tremendous effect on the women we talked to, but they also spoke about how it affected their partners and other members of their extended family. It shaped the way that people were communicating with each other during this time, including who had access to visit both in the hospital and at home. And it really had a profound effect on people's relationships. For instance, we found that in some cases where women or couples decided to be particular about who could come and visit or who could touch their baby, sometimes they had lifelong relationships that were damaged because of some of those choices. Some family members had expectations for being able to come and visit and hold the baby and all those sorts of things. And when that didn't work out, some of the rules that women and their partners had created might affect that. On the other hand, it was also a phenomenon that women and their partners would bond or become closer as a result of kind of working together to manage how people might visit the baby. In terms of the hospital, childbirth can be such a joyous time, and often that involves entire families and different cultural rituals for people coming to visit during the birth or after birth, or being present at the hospital in some way. And because of institutional policies during COVID, that was not always possible. So that affected women and their partners. Extended family members like grandparents were also affected by that. So it's kind of a far-reaching effect of rules and policies. But as you mentioned a moment ago, some women and couples really tried to focus on what they called those silver linings, especially in the hospital. We had lots of women in our study talk about how not having visitors allowed them this dedicated time with their partners and the newborn that they might not have had otherwise, and they really appreciated that. So that was kind of an unexpected silver lining that we didn't really expect to see that in the data. So it shows how people can be resilient and still find those blessings in a really difficult time.
Yeah, thank you, Dr. Maria. My next question for you, how this research can contribute to quality of maternal care?
Yeah, so, well, we know that the restrictions cause a little bit of distress initially, and we've learned a lot from that. And that's, like we'd said before, it was often because of the unexpected nature of those restrictions. People were expecting to be able to have their partner and their parents and, friends or whatever be there to support them at the hospital. And that was taken away from them somewhat unexpectedly. But historically, women have birthed with a lot of support. And in many cultures, that's a lot of family members, support networks that are there, and not just a partner. And so women had that expectation that they were going to have this support. And having that restriction on the number of visitors, actually, as Jen had just said, was actually a blessing in disguise in a lot of ways. So, Jen had shared a lot of the women felt like, well, they had this opportunity now to bond with their baby uninterrupted. They could bond more closely with their partner. They could decide together, what they needed to do to take care of this baby. And so also the healthcare providers were focusing more on the mother and the baby as opposed to managing all the chaos that sometimes happens when there's a lot of visitors coming in and out. And so a lot of women said they actually got more individualized care. They felt that the healthcare providers were really focusing on them and their needs, and they felt valued in that. And so that was really good. They got more individualized attention. And now that healthcare providers have, all of us actually have worked through a crisis like a pandemic, I think it's important that we look at how that has affected patients. And healthcare providers can learn, that this doesn't have to necessarily be a bad experience for the patients. It's just, I think what Jen and I saw is like the communication element is just so important. You have to communicate with patients in a timely manner, what the expectations are, so that they're not kind of blindsided by things and they can plan. A lot of people want to be able to plan for things. A lot of the women in our study talked about the fear that they had because they would see reports in the media about, I'm not going to be able to have my partner in there with me, or they're going to take the baby away from me, or, things like that. And that just amplified the stress and the fear that a lot of these women had. And it was really unnecessary in a lot of cases. And we know, childbirth is filled with a lot of uncertainty. So if healthcare providers can kind of mitigate some of that by communicating, proactively and letting women know what to expect, we really think that women's maternal health care is going to be enhanced.
My question for Dr. Jennifer, can you discuss from your research finding, how this can affect implication for policies and practice?
Absolutely. I think building off what Maria just said, our findings really illustrate the importance of communication from healthcare systems and from healthcare providers. So, as Maria said, people had a lot of fear hearing media reports about what birthing might be like during the pandemic. And sometimes they didn't know until they got to a hospital what their restrictions were going to be or exactly what things were going to look like. So anything healthcare systems can do to proactively communicate with patients can help reduce some of that fear. Then we also found that women in our study relied on healthcare providers for recommendations about who should have access to visit and hold and touch their newborns. Being able to say, my doctor said this is not a good idea, or, our pediatrician recommended this, that can help people create those rules for access that we were talking about earlier. It helps reduce their uncertainty and kind of gives them an expert to rely on to make those rules a little bit easier to establish. It almost kind of gives them somebody else to blame. Our doctor said that this is or is not a good idea. And so again, if healthcare providers can be proactive about giving patients some guidance that they can fall back on, that can really reduce some of the stress of managing these interpersonal relationships, not only in the hospital, but once women and partners and newborns return home.
Do you have any clothing thoughts or specific items you want to leave to our listener, Dr. Maria?
I think it's just really important that we remember that the ultimate goal is the health and safety of the mothers and their new babies. And so, and this includes not just their physical health, but also their mental health. And so thoughtfully communicating can definitely improve the mental health of all those involved.
Thank you. Dr. Jennifer, do you want to make any clothing thoughts from your research?
I would just reiterate what Maria said about both physical and mental health can be improved through communication. So we focused a lot in our discussion today about kind of keeping women and newborns safe from exposure to the virus. And that's what rules and institutional policies were meant to do. But proactive communication and giving women some guidance can also help with their mental health by reducing some of the fear and anxiety that happens during this uncertain kind of time.
That's great. Thank you very much, Dr. Jennifer and Dr. Maria, for being with us today and for your precious insights. Thank you.
Thank you.
Thank you. It was a pleasure.
Thanks for listening to the JCIH podcast, Health and Communication Distilled, a podcast of the Journal of Communication in Healthcare, Strategies, Media, and Engagement in Global Health. Follow the journal on Twitter at JCIH Online for news about the articles we published and other resources. That's JCIH Online on Twitter.